Chief.
Eu por isso não jogar conforme o salame. Yonga.
Okay, pleasant welcome to another edition of our health. This is a 30-minute television program that explain give you a better understanding of holistic healthcare, a better understanding of healthy living, and we also look at national policy when it comes to healthy living. So today, on uh, on today's edition, we have with us a special guest. She's Dr. Dieter Superwood, and she will be introducing herself. I hope every one of you are glued and listening because this show is streaming live on Super TV and also streaming on our terrestrial TV in Liberia here. So those those of us in Liberia who don't have data, we can put on our TV set and then we will be able to listen to the show. So let me bring in our guest who will better introduce herself so that we can begin our discussion on today's edition. So welcome, ma'am.
Thank you, Joyce, for having me here today. I'm excited.
Okay, so welcome to our health. There is a show that we explain and give our audience understanding of healthy living and understanding of healthy behavior, things that we need to do to live healthily, and how we can manage our environment. So, can you please introduce yourself for our audience?
Okay, my name is Tere Ibisubut. I am a Liberian hailing from Lofa County, and I'm a yes, Lofa strong. I am a medical doctor, and I graduated from Liberia's only medical college, the AMWLT College of Medicine, in 2016. And then after that, I was fortunate to obtain a scholarship to specialize in cancer. So that's where I am right now. Well, that's what I'm doing right now in Egypt. And I'm a final year resident doctor specializing in cancer. Yeah, that's just about it about me.
Okay. So today, basically, we're going to be looking at breast cancer. So tell us, what is breast cancer?
Okay, breast cancer. Yes, I love talking about cancer and I love talking about breast cancer. Yes.
Why you choose that? Why you choose that area?
It was personal because I lost my mother to breast cancer when she was 48 years,
That's
and
sad.
I was in my final year in college, my final semester in college, actually, Cottington University in 2009, and I guess I gravitated towards the field of cancer because I watched her struggle for 8 years with the disease, and there was nothing much I could do. So I said to myself that if there's anything that I will specialize in, I will specialize in cancer because I don't want families going through the pain and trauma that my family and I had to go through, watching
Mm.
our mother, our loved one gradually fade away because of the disease. Yes, so you asked me what is breast cancer. I cannot tell you what is breast cancer without telling you what is cancer as a whole.
Okay, no
So
problem.
yes, so when we talk about cancer, we are basically talking about cells in the body that are growing out of control. When the body needs something, it sends information, and then when it receives it, it has had enough, it says stop. So with cancer, the cells will be growing, and then the body will send signal to say, I know you need to stop, but these cells will not listen, or this cell will not listen, so it will grow continuously. And whatever cancer occurs in the body is how they take the name. So if you have cancer occurring in the breast, it will definitely be called breast cancer. So breast
Okay.
cancer, in short, is just referring to cells that are growing uncontrollably within the breast yeah, of the human being. So that is just breast cancer definition in short.
Okay, so who is mostly at risk in coming in contact with breast cancer? Who is mostly
Oh,
at risk when it comes to breast cancer?
okay. So when we talk about risks related to breast cancer, there are several
Hmm.
things that can put you at risk of developing breast cancer, and
Okay.
we have to briefly talk about that. Now,
Hmm.
the risk factors for breast cancer, and risk factors simply means those things that will increase the chance of you developing cancer. It
Okay.
doesn't mean that you will develop it, but it simply means that your chances of developing cancer increases. So for breast cancer, they are divided into two broad categories. We have the modifiable ones. That means the ones where you can adjust your lifestyle and then
Hmm.
it will reduce your risk factor. And then you have the ones that you cannot do anything about, and those ones are called the non-modifiable risk factors. So
Hmm.
let's start with the modifiable ones where you can adjust your lifestyle. Being obese or overweight, lack of physical activity, excessive alcohol intake, use of oral contraceptive, and there's this treatment we give the women who are in the menopause to prevent the postmenopause symptoms. So it's called the postmenopause hormone replacement therapy. So yes, so if you're taking any of those, it increases your chance of developing breast cancer. Now, they fall on the modifiable ones, like I said, because you can adjust the lifestyle and avoid them, and it will reduce your risk of developing breast cancer. For the ones that cannot be modified, the non-modifiable ones, the first thing you have is being a female. Yes, females are more at risk of developing breast cancer than men, even though men can develop breast cancer as well. But females are more at risk of developing breast cancer. So, being a female is the most common non modifiable risk factor. Next, you have old age. The older you get as a woman, the higher your chances of developing breast cancer. Family history of previous breast cancer, or a family history of having cancer of the ovaries also
Hmm.
increases the risk of having breast cancer. Yes. If you have had any treatment to your chest, previous radiation treatment because of something else, it also increases your risk of developing breast cancer. If you as an individual had breast cancer before, it also increases your risk of developing breast cancer. Now, for the then we have what we refer to as the hormone effects. I don't know how the right word to use, but early menarche, that is
Hmm.
women receiving seeing their period before the age of 12. If you see your period before the age of 12, it's a risk factor. And if your period lasts longer than 55 years, beyond 55 years, late menopause, that's another risk factor also. If you have never given birth before, nulliparity is another risk factor. And if you have your first full term pregnancy beyond the age of 30, that is the delayed first full term pregnancy, it's another increased risk factor for breast cancer. So
So,
that's a whole
you
lot.
were talking.
Yeah, there are several things.
I now wanted to cut you off. You were talking about men uh coming down with cancer. So how does that apply? I haven't heard of it before. So maybe someone who are watching or wants to know how it affect men, how men comes down
Yes,
with breast cancer.
although it is very rare, but men can develop breast cancer as well.
How?
And it usually has to do with family history. So there's this gene in the body.
That's
There's some
hereditary.
yes, it's hereditary. It can be hereditary. It can be. It's very rare, but it's possible. There's a gene in the body that we refer to as the BRCA gene,
Mm-hmm.
and that gene is associated with several types of cancers, especially breast cancer.
Mm-hmm.
So, but apart from breast cancer, it can also be associated with cancer of the prostate. It can also be associated with cancer of the pancreas. So, if you have a family history that has the BRCA gene and there's someone who has had breast cancer in your family or prostate cancer in your family as a male, your risk, even though the risk is very minimum, but there's still the chance of you developing breast cancer. Yes, and I have seen at least 3 cases of men with breast cancer here in Egypt. Yes, so it does exist. Sorry.
Okay, okay. So now tell us, what are those sounds and symptoms when it comes to breast cancer? Because you know we just living in Liberia, we get anything and then we move on once we don't feel certain pain or once the sickness don't get severe, we don't go for medical checkup. So what are those signs and symptoms? One showing, then it tells you that gradually you are coming down with breast cancer.
Okay, so for every type of cancer or most types of cancers, from the early stage, you might not have any symptoms. You might
Okay.
not have any signs. You might discover them accidentally. So that's the first thing. So you might discover breast cancer. You might not have any symptoms. You might not have any signs. It might be discovered accidentally. But when they do present with symptoms and signs, the most common one is having a lump in the breast.
Mm-hmm.
Okay, the lump
Mm-hmm.
or knot, as we'll say in Liberia. So you might either have a knot or a lump in the breast, or sometimes the lump will not be in the breast. Sometimes it might the first place it might appear will be underneath your arm. And the
Mm-hmm.
reason for that is because the first place that cancer spreads is to the lymph nodes underneath the arm. So lump in the breast or underneath the arm is a sign of breast cancer.
Mm-hmm.
You might have nipple discharge as a woman, and you are not, if you are not breastfeeding, you're not supposed to have any nipple discharges. So if you find yourself having nipple discharges, especially bloody nipple discharge, it should raise, it should raise an alarm to you that something is not right.
Mm-hmm.
Another thing is wherein you might see as a female that your nipples are going in. We call it nipple retraction. So
Mm-hmm.
your nipples not supposed to go in, but if your nipples look appear like it's being pulled in, yeah, it's another symptom of breast cancer. And then you might notice skin changes of your breast. So the breast might appear to be it might be appear if you light in complexion, it might appear red, it might appear warm, it might feel warm, it might appear swollen, it might be bigger than the other breast.
Mm-hmm.
Yeah. So if your breast appears red, warm, or swollen, that's another
Mm-hmm.
sign. If you are dark in complexion, the skin of the breast might appear darker than the rest of where it might appear darker than the rest of the other skin. And then another thing is the skin, you might have what we call orange peeling like skin appearance. You know how orange peeling looks, right? Where you have so many dimples on it. They
Mm-hmm.
have, when you buy an orange and before you peel it, the orange got peelings in it, the dimplings rather. So
Mm-hmm.
if you notice your skin got dimplings looking at orange peeling, that is another sign of breast cancer as well. And
Mm-hmm.
then last but not the least, sometimes you might not have any of these symptoms, but you might experience pain. You might just keep experiencing pain in the breast,
Mm-hmm.
which of course is not a very common presentation, but it's also another way in which breast cancer can present. So if you have a lump in your breast or under your arm, if you have bloody nipple discharge, if you notice the nipples going in, nipple retraction, if you notice changes on the skin of your breast, or if you having pee in the skin, yeah, please
Mm-hmm.
try and visit your doctor because those are all signs and symptoms of breast cancer.
Okay, so once you're feeling pain, you can visit your doctor. That's an advice. But in Liberia, we had to go for checkup. Yeah.
Yeah, better
So
safe than sorry. So
once
if
it's not
you're in a
severe.
pain, yes,
Mm-hmm.
better
So
safe than
now
sorry.
tell us. So now you just give us some of those sounds and symptoms when it comes to breast cancer. So now, how can I lower my chances in coming down with breast cancer? How you know?
Okay, then it goes back to the risk factors. Okay,
Okay. All right.
when
Yeah.
I
Sure.
talked about the risk factors, I
Mm-hmm.
mentioned that they can be the ones that can be modified and the ones that cannot be
Mm-hmm.
modified. So
Mm-hmm.
for the ones that cannot be modified, you cannot do anything about it. You cannot stop getting old, right? You cannot change the
Mm-hmm.
fact that you're a female because it's something that you cannot afford. But for the ones that you can afford, the modifiable ones like drinking alcohol, you can
Mm-hmm.
stop drinking alcohol or reduce your alcohol intake. You watch your body size, try to not be overweight, I'm sorry, obese, try to have a healthy body weight, eat healthy, eat a balanced diet that will not make you have gain over be overweight, exercise
Mm-hmm.
regularly, at least 30 minutes 5 times a week, 5 days a week for at least 30 minutes. That's a healthy lifestyle. If you are taking oral contraceptive pills, or what we refer to as birth control pills, the one that
Okay.
people can
Okay.
take so they can get pregnant, Yes,
Mm-hmm.
you
Like
should
family planning
avoid
or
that.
other contraceptive. Okay.
Yes, you should avoid taking birth control pills. And for those women who are already in the menopause, if you avoid the postmenopause hormone replacement therapy, yeah, you will be reducing your chances of developing breast cancer. So yeah, that's it.
So, now you're working with a breast cancer team, I guess so.
Yes, not just breast cancer, it's a whole cancer team I'm working with that
Oh,
deals with
okay.
all types of cancers,
Is it
blood,
in
brain,
Liberia?
bone. Excuse me?
Is it in Liberia or
It's
out
if
of
it's in
Liberia?
Liberia.
Mm-hmm.
No, currently in Egypt, but
I'm talking about the institution. I'm
the
talking about
institution.
the breast cancer institution that you form part of. Is it in Liberia?
Oh, okay. So there's this organization I'm a part of, the
Okay.
Liberia Cancer Resource Initiative. I don't know if that's
Yeah.
what you're referring to.
Yeah, yeah, sure.
Yes, it's here. It's in Liberia, and they will be hosting a walk on Saturday. The walk will be
This
starting at
coming Saturday, right?
yes, this coming Saturday, October
Oh.
30th, from
Mm-hmm.
6:30 a.m. The walk will start from the SKD Sports Complex, yes,
Mm-hmm.
in
Mm-hmm.
honor of the Breast Cancer Awareness Month. So, yes, LCRI is in Liberia and they have t shirts on sale right now for the walk. T shirts are on sale at Grand Royal Hotel and also at Body Zone on the bypass. So if you have the opportunity, you can just stop by and also screenings and other things that have been going on during the course of the month that LCR has been involved in. Yeah.
So
So
where you people conduct the stream?
the screening was conducted. There were several screenings conducted throughout Monserrado County. The last one I know about was conducted at the Chefney Barracks in Chefney on the highway in the Army Barracks. The is it
Mm-hmm.
S Kesali
Carefully
Barracks on the
Boulevard.
highway? Yes,
Mm-hmm.
yes, on
Yeah.
the highway. Yeah,
Mm-hmm.
that was this week. And then there was another area. I don't recall much of that. I was hoping that someone else from the organization would have joined us to give us more information about that. But yeah, I know that most screenings should be taking place on Saturday at the walk. Yeah.
So because we are celebrating breast cancer, there is a breast cancer month, right? So
Yes.
this training, do you people have this training on a regular basis or only for this month?
That's the problem, I must admit. It's better just focus in October, and that is something that we need to work on because I see it's not just LCRI, it's everywhere in Liberia now. I see. I'm happy. Don't get me wrong. I'm happy that people are trying to get more involved. October is the month for breast cancer awareness, so people doing breast cancer awareness all over Liberia in the month of October. But I hope that it shouldn't stop in October because it's not just in October that people get breast cancer. People get breast cancer throughout the year, so the awareness should not just run in October. It should be an everyday thing. Situation should be throughout the year. So I'm hoping that throughout the year and as time goes by, there will be even more awareness is going on, not just in the month of October, but from January to December, that more awareness will be going on for breast cancer and not just breast cancer alone, but
Okay.
all the other types of cancers that we come across in Liberia. Yeah.
Okay. So now, tell us now, what are those stages of breast cancer? And at what point, because we know that we have several cancer, but basically we are so concerned about breast cancer because we find out that this month is breast cancer month. It's dedicated to those who have died of breast cancer and those who are surviving with breast cancer as well too, right?
Yes.
Okay. So tell us, what are the stages of breast cancer and at what point it becomes severe?
Okay. So breast cancer can be divided into four stages.
Okay.
You have the stage one.
Mm-hmm.
In I'm just going to summarize it because it's complicated. But in a simple form,
Just
stage
make
one
her to
breast
understand.
cancer.
Just make her to understand.
Yes,
Yeah.
just to make people understand, yeah.
Okay.
Stage one breast cancer is limited to the breast, wherein the cancer is only in the breast.
Mm-hmm.
Stage two, the breast cancer has spread to the lymph nodes of the arm. So the
Mm-hmm.
breast cancer is in the breast and it has also spread underneath the arm. Okay.
Mm-hmm.
Stage three, the breast cancer has spread to your chest wall, the skin, the outer skin involving over the breast itself. It has gone up to your neck, your collarbone,
Mm-hmm.
right? Yeah, breast cancer can spread to your collarbone, to the neck, the lymph nodes of the collarbone. So if it spreads to the lymph node of the collarbone, or it spreads to the skin of the chest wall, or there are other lymph nodes within your chest cavity that you cannot see, if it
Mm-hmm.
spreads to those lymph nodes, and then it's stage three. Stage four breast cancer is what we refer to as the metastatic cancer, where it has spread to other organs like the bones, the liver, the lungs, your brain. Yeah. So when it spreads to other places or even the other breast, then it's
Mm-hmm.
stage four breast cancer. So yeah,
Okay.
in a simplified form, those are the
Mm.
four stages of breast cancer.
So at what point it becomes severe that
Well, well, it becomes severe when it spreads when it's stage three and above.
oh, stage three, once it's stage three and above, then
I
it's
would say
severe.
it becomes more difficult to treat. Let me put it that way, because even if it's pressed to the axillary lymph node, it's a problem, but it becomes more difficult to treat when it's pressed to the from stage three and above. Yeah, it's more difficult. So yeah, those are more advanced stages from stage three and above. Yeah.
Okay, so folks, for those of you who are watching this interview on our health, this is a 30-minute television program that give you better understanding of health issue in and around Liberia. And today we are with Dr. Superwood, and she's educating us on breast cancer, on way that we can get rid of breast cancer, and a way that we can live with it by taking all of our necessary treatment. So before we come into our second segment, where she will be telling us whether breast cancer is curable or not, or what are the medical or attention that need to be applied when it comes to breast cancer. So once you're watching, you can also send in your comments, and we will pick questions from all of your comments, and then we will be able to ask her that she will be able to get to her and explain properly that we all can understand what she's saying. So, Doc, back to you.
Yes,
Hope you're doing good.
I am.
Okay, that's good. That's good. So now, tell us, once diagnosed with breast cancer, hmm, do I still need another test to be run in order for me to be treated?
Yes, you need to have several tests done,
Mm-hmm.
as a matter of fact, because with breast cancer and every other type of cancer, the first thing you need to establish is you need to establish that number one, this is indeed cancer that I'm dealing with or that I would be dealing with. So the first thing you need to do is, and every cancer test needs to be confirmed by a pathologist. It's another doctor who is specialized in studying the cause of diseases. So the pathologist has to confirm on a tissue specimen that is taken from within the mass.
Mm-hmm.
He will go in and remove some of the tissue, and then he will look at it. He will do his different thing by himself. I can't be there for that one. And then he will, yeah, and then he will say whether it's cancer or not. So once the first thing you need to do is to establish with a pathologist report that this is indeed cancerous.
Mm-hmm.
Okay, so when that is done, it doesn't start there. That is actually when the marathon really begins. I say
Mhm.
marathon because it's like a run for your life, or I don't know how you want to put it, right? Because after that, yeah, because after that, then you have several tests to do, because you cannot start the treatment if you don't know the extent to which the cancer is in the body. So you
Mhm.
have to do several different tests. You have to test your liver, you have to test your kidneys, you have to check your chest to look at the
Mhm.
lungs, you have to check in your abdomen so you can do CT scan and several other tests that I don't think the public should be bothered with, because it's not really going to be, yeah, that should be, it's more of a medical thing, but there are several tests that you need to do, because based on those tests is how you will be staged as a patient. And
Mhm.
based on your staging is how your treatment will be tailored for you as an individual. So yes,
Mhm.
apart from being diagnosed with breast cancer, there are several other tests that you will need to do to check your electrolytes, to look at your liver, your kidneys, because I told you breast cancer can spread to the liver, right?
Mhm. Mhm.
You
That's
have
true.
to make sure the liver is okay. You have to make sure the kidney is okay. You have to make sure it's not in your the chest is okay. The lungs, your blood. Look at your blood to make sure your blood is not low, and several other things, because whatever abnormality that you find in all of these tests, they can affect the way in which you will be treated. So yes, several other tests need to be done besides being told that you have breast cancer.
So we are talking about tests here. So now, what are the ways to detect breast cancer at an early stage? Tell us.
Okay, breast cancer staging screening starts from yourself as an individual. As a
Okay.
female, we have what we call the self breast examination. That
Mhm.
is where, as a female, like every month after you have received after you have seen your period, you have to check your breast by yourself. Just look at it. If you can't do it, if your husband or your boyfriend is around, you can ask them to help. So you do, yeah. So you
Mhm.
have to do the self breast examination. That is where just looking at is checking your breast for anything that does not look normal. Um, you do that by standing in front of the mirror, look at your
Okay.
breast, put your hands on your hips and turn from side to side and check to see if there's anything, if you notice anything. Lift up your hands and look from side to side as well. You got to look at the size of your breast to see if both of them are equal. If there's any skin changes, to look for nipple retraction to see if the nipple is going in. After you do that, you use the inner part of your palm right here that I'm indicating. As you can see, I don't know if you can see my hands right
Yeah,
here.
sure, sure.
Yes, okay. You just feel around your breast, gently, and feel if there's any lump within your breast. Check underneath your arm, doing the same thing. And then when you have done all of that, you can also squeeze your nipples to see if there's any discharge coming from there, to see if there's any blood or any milk or anything. So you can either do that standing up with your hands up in the air, one hand above your head while you're checking the other one, or you can lay on your back to do that. You can do that and do it with both breasts, or you can ask your partner to help you look at your breast and help you feel for anything that is not normal. So that is it for the self breast examination. And it's better to do it after your period every month as a female. So the first way to screen for breast cancer is to do your self breast examination. After the self breast examination, if you don't know how to do it and you don't feel comfortable doing, or you don't feel comfortable doing it yourself, you can do an annual visit with your doctor every year. At least visit a doctor at least once every year for a clinical breast examination, where the doctor will be the one checking your breast for you. That's the second way. The other way in which you can screen for breast cancer is by doing the X-ray of the breast that people are doing all around right now. Everybody talking about screening. It's called a mammogram. That
Mhm.
is actually X-ray of the breast. Yes. So the self breast examination, the clinical breast examination, and the mammograms are the ways in which you can screen for the breast. Sometimes you can use the MRI, but it's not so common because there are specific instances in which the MRI can be used. But the most common one is the mammogram, and that can be done in the hospital. So yeah, that's it for if you want to check for breast cancer. And all of these are geared towards detecting the breast cancer early enough so that you can receive treatment early enough so that you can have a better outcome, because early detection, as we all say, saves lives. The earlier you present, the earlier you get treated, the better the outcome for you as an individual.
So early detection is very much important, right?
Very,
Because
very important.
because it saves your life. Because once you are not detected earlier, it may lead to other complication, and you may also die in the process. So now before we come to the end of this interview or the end of this show, is that are there complications of breast cancer, or is there any treatment attached to it?
Okay.
Because yeah, go ahead, go
Yeah.
ahead.
Breast
Mm-hmm.
cancer, there are several complications surrounding breast cancer.
Mm-hmm.
So it might not necessarily be as a result of the breast cancer itself. Sometimes the complications can be as a result of the treatment that you are receiving.
Okay.
Because while the cancer has its own effects on the body, the cancer drugs, they are also toxic to the body as well. So they have their own complications. So
Mm-hmm.
the first complication I would like to mention about breast cancer diagnosis is the fact of depression.
Mm-hmm.
Yeah, depression. I refer to depression as a complication because telling someone that they have breast cancer, telling someone that they have cancer, if they don't know, it's like, especially in Liberia, it's like telling someone that you are about to die.
Mm-hmm.
You get my point, right? So, and telling someone that you are about to die indirectly, that person, mentally, if they cannot handle that information, they could get depressed.
Mm-hmm.
And if that person becomes depressed, you might have that person not presenting to the hospital to get treated, and that cancer will just be there and you'll be eating it up. And as a result, they will end up dying. So, one of the first thing I would like to mention as a complication is depression. The next thing is that breast cancer can be associated with not just breast cancer, but the treatment of breast cancer as well. It can be associated with fertility issues. So
Mm-hmm.
yeah, so you could have fertility issues. Another complication in this one could be as a result of the drugs that you are taking, or the treatment. Based on the type of treatment that you are receiving, you could experience loss of hair. Your hair can drop from your head. Your hair might get bald, or you might lose a lot of your hair. You might
Mm-hmm.
experience like feeling like you want to vomit and vomiting. There, and then to be even more specific, there's a type of breast cancer treatment that we refer to as the hormone therapy. And they are associated with thinning of bone, making your bones thin. Some of them will make your bones thin and increase the risk of you having fracture or breaking your bones. And
Mm-hmm.
some of them can increase the risk of you developing blood clots. And developing blood clot is very dangerous, because if you have blood clots in your body, wherever that blood clot is formed, it could dislodge from there and it could go up to your lungs. And that, depending on the size of the clot, you might have a massive, problem that can be even that can kill you within few minutes. You
Mm-hmm.
might, if the clot is very big, you might have somebody complaining, like, oh, I'm having chest pain. And then within a few minutes to an hour, that person would die, and you will say that wish. Then I wish. Probably, yeah. Then I wish probably that person had a very huge blood clot that was stuck in the vein, the blood vessels of the lungs, and that could have led to AS. So sometimes the treatment of breast cancer can lead to you, increases the risk of you developing blood clots. Also, breast cancer can also, taking breast cancer treatment, some of them can also increase the risk of developing cancer of the inner lining of the womb, what we refer to as the endometrium. So there are several associated complications. And then last but not the least, of course, if you don't take care of deal with it properly, or if the disease overpower you, you will die. So death, I would also like to say, is another complication of breast cancer. Yeah, so there are several other complications that I did not mention, but these are just few of the complications associated with breast cancer. And sometimes, like I said, it's not the cancer itself, but even the treatment that you receive can even make you develop some of these complications. So there are so many complications associated with breast cancer.
Breast cancer. Okay. So, tell us, what are some unique facts about this breast cancer? Even though we are not discussing other cancers, but basically we are on breast cancer. So, what are some unique facts when it comes to breast cancer that you can be able to tell us?
Okay. One of the unique things about breast cancer is that it changes is the change of body appearance,
Okay.
right? Because one of the ways in treating breast cancer is removing the breast. Even though in advanced countries, sometimes when they remove the breast, people can still go back and do other cosmetic surgeries and they can put fake breast there. But I'm not sure if we have reached that point in Liberia where we can do the cosmetic surgery and put fake breast tissues back in of changing your appearance as a person, is as in removing the breast is something unique because breast is part of our female structure. It's part of the beautification for us, right? Because our African men, the leg,
Yeah,
they're
mostly I try to
blacker or the
remove
leg
that breast.
chesty, yeah. So yeah. So if I owe you a Chelsea fit before, if you getting me
Mhm.
in, and then you
Yeah,
have
sure.
to, and then, and then they have to remove, one of Chelsea me defender them from the
Mm-hmm.
field.
Mm-hmm.
Yeah, it could be, it could create a problem for you. But yeah, so body, and then because of that, people become more self-aware
Mm-hmm.
of themselves. It will reduce your self-esteem as a person because it will affect your self-esteem. So that is something that the body shaping, reshaping. It's something. Yeah, and another thing is that sometimes the drugs that people take associated with breast cancer,
Okay.
it can also like affect the sexual drive. So sometimes they might have reduced sexual drive, and so they might have problems with you know having sex with a partners or something like that. Unique about breast cancer. What else is unique about breast cancer? Breast cancer, it's very common. It's not the most common cancer amongst Liberian women. The
Is
most
it
common
contagious?
uh,
Is it contagious?
no, it's not contagious.
Oh,
It is
okay.
not contagious. Yeah, so you don't have to worry about that. But it is depending on the type of breast cancer you have, you could live with it for years. And where you find yourself, and if you have proper treatment, you can live with breast cancer. You could receive proper treatment, and the cancer could go into remission as if as in that means you will be living the cancer will you have received treatment and all the cancer cells will be removed from the body so you will live without cancer. That does not mean that you have been cured. That means you are in remission because the possibility of the cancer coming back is very high. So yeah, there unique about breast cancer. I don't know if it's just breast cancer, but there are so many things associated with cancer here because it can even affect your everyday activities as well.
Okay. Mm-hmm.
Yeah, because as you take it, these, let me tell you something, these drugs that people give for breast cancer and any cancer, they are not just the malaria kind of drugs that we take around here. They are very strong drugs that can be very, even though they will be treating the cancer, killing the cancer, but sometimes they can kill the normal tissues, the normal cells in the body too. So they can be very toxic to the body. So sometimes you'll see somebody being treated for cancer and they will be losing a lot of weight as well.
Mm-hmm.
And it comes with a
Mm.
lot of complications and so many things attached to it. So there are several things, yeah, associated with breast cancer that you need to look out for. And yeah, the earlier you present, the better your chances so you can prevent some of these things. Yeah.
Okay, so before we take leave of you, Dr. Superwood, so what are some things that you want to talk about when it comes to breast cancer that within? Touch.
Um, I don't know. I think basically we covered everything, but people will be wondering how can breast cancer be treated.
Mm-hmm.
In summary, there are several ways you can treat breast cancer. You can treat
Mm-hmm.
breast cancer with medicine. You can treat breast cancer with surgery, operation. You can treat breast cancer with radiation. And based on the type of cancer that you have, and based on how far the cancer has spread, and based on your presentation as an
Mm-hmm.
individual, whether you have any other comorbidities like pressure, sugar, kidney problems, or whatever, they all affect the management of breast of your cancer. But what I want to leave, the message I want to leave with everyone is that cancer is real.
Mm-hmm.
And cancer is in Liberia. It's more common than we think. And please, um, we when we try to share these messages, it's not because we just want to talk, but it's because for Liberia, where we don't have state of the art health facilities, our chances are better with preventing. Okay, our chances are better with preventing. Our chances are better with presenting to the hospital early. So I just want to encourage everybody here and remind them that breast cancer is real and breast cancer is in Liberia. Um, Early detection is very important. Please, females, as long as you are receiving your period, when your period finish every month, please feel your tete. Like your own set tete enough for nobody. Yeah, don't be scared to test yourself. Feel
Or
your
if you
tete,
if,
check.
or if you don't
Yeah,
want to do it, ask someone.
yeah, you now want to do it, you can ask your husband or your boyfriend to do it for you. After all, they putting a bit testing it will or even asking you. So so yeah, do your breast examination every month, please, because that is one of the commonest ways in which people can easily detect that something is wrong. Now, detecting it does not mean you have breast cancer. If you feel lump in
Mhm.
your breast, or if your tete nipple go in, or you see blood
Okay.
coming out, it not means that you get breast cancer. It means you must go to the hospital to the doctor to go check and see what's happening. And you see, I changed my tune, I put it in Kologwa, right? Because
Yeah.
I want people to understand. Yeah, so I don't want people leaving from here today saying that I'm supposed to say when I get lump in my breast, I mean I get breast cancer. No. It means if you check and you find something is wrong somewhere, please visit the hospital.
Okay.
And if you can afford it, please try to have your mammograms done at least if you 40 years and above, at least one time every year you can go and do the x-ray of your breast, which is the mammogram, because
Mm-hmm.
that is the fastest way to check to see if there's a lump in your breast. Yeah, because when a mammogram see the mass in the breast, you will still have the doctor will still have to take tissue from there, sample from there, and go the pathologist to go check for it. So please let us encourage everyone to do the self breast examination. Let us encourage people to do breast screening by trying to go in for the mammograms as often as they can, at least every year from the age of 40. And remember that breast cancer is real. If you notice your breast getting big, it gets swollen, then I'll go out. I beg you.
You said from
Then
the
I'll
age of
go out.
40 to do the mammograph? Only from the
Yes.
age of 40?
That's what the guideline says, that it's preferred that you can go from the age of 40. If you have a family history of breast cancer, you can start screening earlier than that. It's okay. But standard practice encourage people to start going after the age of 40 years, at least every year to go for the guide for, at least once a year mammogram screening. So
Okay.
yeah, my people, if you see anything happening in your breast, if the skin of your breast looking different, it looking like orange peeling, I like to make my description in a way, the explanation in a way that people will understand and relate to
Mm-hmm.
it. If you notice your skin looking like orange peeling, if you notice your tete nipple going inside, if you see blood coming from there, if you're feeling knot inside your breast, please, or if your breast, if one of it looking bigger than the other one, do not go out. please go visit the doctor. Yeah, I'm saying it because the rate of illiteracy is very high in our country, and because people
Yeah,
don't know
true.
about these things, they present late to the hospital when there's not much can be done. So please, I really really love to stress on awareness and encouraging people to come to the hospital early and encourage them and tell them things that they can do to reduce the risk of developing breast cancer and whatever other type of
Yeah,
cancer, because for
you're
us
talking
in
about
Liberia, that's the best way we have to go.
illiteracy, right? So what are you guys putting in place in order to reach a message to those that are in the rural sector? Because you find out that most of the breast cancer awareness is done in
You
most
trying to
surroundings.
ask me a political question right now
No,
that I'm
no,
not in a
no,
position
no,
to
no,
answer.
no, no, no,
Listen,
no.
what
I'm
I
not.
can tell you for a fact,
Okay.
what I know,
Hmm.
what I know is that I have my little cancer page on Facebook. It is called Basic Cancer Facts. I try to do posting at least every week about cancer, not just breast cancer, because every month there's the whole year we have cancer calendar. So
Hmm.
every month there's another cancer that is being awareness is being created about. Like people, most people don't know that even though October is the month for breast cancer, but October
Hmm.
is also the month for liver cancer as well.
Oh, okay.
Yes,
So
October is also the month for liver cancer.
any other cancer, or only for the two of them, liver
No,
and breast?
for the month of October it's just breast and liver. Last month it was for gynecologic cancer, cancers that are affecting the female reproductive system, cancer of the ovaries, of the birth canal, of the womb, the inner lining of the womb, all the cancers. The awareness month was last month, which was September. This month is for breast and liver cancer. So yeah, so I don't know much about what is going on, but I know that I do my cancer posting on my page. It's called Basic Cancer Facts. I try to just, if you are going to find out how cancer can be treated, you will not find it on that page because that is not what the page is created for. The page was created to just tell people that these different types of cancers exist and these are the ways in which they can present. Um, what I will encourage all of my colleagues, all health workers in the Ministry of Health to do is to do more awareness. That is as much as I can do from here right now. And when I return home, I also intend to do a lot more awareness program here. I intend to, if it's possible, to go into the interior and, like you said, reach
Yeah,
to our
yeah,
people that are in the
yeah.
interior. Because yes, I know,
Minimum.
even to see if we can put the messages in the various dialects for people to get the message, because for me it's all about getting the message to people that these things, because these things have been killing our people and they don't real we have not realized that these things have been killing our people, and because they don't know, so they don't come. So they sit
Hmm.
and think that somebody not reach there, somebody not throw go out on there, that fire go out, or that younger foe, things like that. And sometimes when you check, these things are really cancerous.
Hmm.
So yeah, awareness is all I can say, and it's my passion to do more awareness when I come home and do as while I'm treating. I intend to do as much awareness as I can. But what the government is doing in terms of awareness, I cannot speak to that. I'm sorry. Um,
Hmm.
for further information concerning that, you can check with Ministry of Health. I'm sure they will be willing
Okay,
to
so
provide.
but Dad, you didn't bring your pain. Where's the pain?
Eh?
What's your pain?
My pen,
Yeah.
I got a pink pen.
Okay, so it was nice having you on our help. We prayed and hope on hosting you again to explain a lot when it comes to other cancers, not only
Yeah, I
basic
will. It will be
cancer.
my pleasure.
All right, thank you so much for accepting our invite, and may God bless you. Thank you so much. So now, folks, this is how we want to draw down a curtain of today's edition of our health. Hope you guys learn a lot, and I hope you guys are taking this basic procedure and these basic preventive measures in order to stop the spread of cancer and in order to help us prevent cancer cases in Liberia and a part of the world. So awareness is ongoing. So by the Friday, theme of cancer will be the Mange. I guess the first lady did horse the other time. So a lot of awareness ongoing. So hope and pray every one of us can join hands in order to prevent cancer spread in Liberia and part of the world. So this is how we draw down the curtain of today's edition of Our Health. Stay tuned. We'll come back next Tuesday and Thursday for another edition. Thank you.